This is Bible School Radio, KDKR, Decatur, Dallas, Fort Worth, KYJC, Commerce, and KMWC, Bethany. On the web at kdkr.org and on all your devices with the Live 365 app. Portions of KDKR programming do not necessarily reflect the views of this station, its management, or staff.
Prudent Money with Bob Brooks is sponsored by the Prudent Money Foundation on 91.3.
Well, so are you confused about Medicare? Today we're going to take a look. Stay tuned for Prudent Money. Good afternoon. This is Bob Brooks, and you are listening to the Prudent Money Radio Show. Thanks so much for joining me today. You know I do appreciate it. What is Medicare and how does it work? Sounds like an easy question. Unfortunately, there are a lot of mistakes that are being made. Medicare expert and author Danielle Roberts is here to help us understand those mistakes that people are making and talk about her new book, 10 Costly Medicare Mistakes You Can't Afford to Make. Danielle, welcome to Prudent Money.
Oh, my pleasure. Thank you for having me.
You know, let's start out and make sure everybody's on the same page and just get some definitions out, because it's amazing to me how many moving parts there are when it comes to Medicare. And it's just amazing. So talk a little bit about what Medicare is, make sure everybody understands, and who is eligible.
Sure. So Medicare is important to distinguish from Medicaid. Medicare is insurance provided for people in the United States who are age 65 and older, and also some younger people who may have a disability or a certain life condition like end-stage renal disease. And then Medicaid is insurance that you can qualify for based on your income, and that is something you can get at any time of life. Sometimes you might have someone with both Medicare and Medicaid that work together if you're somebody eligible for Medicare and you're also with low income. But for the vast majority of Americans on Medicare, which is about 67 million people today, they are in straight Medicare parts A, B, C, and D, and we can certainly dive into what those cover and how they work if that's helpful.
Definitely want to do that. I want to talk about, before we go there, one big mistake that you see people making, which is delaying Medicare without credible coverage.
Yes, that is a big mistake. So I think the problem happens because you work your whole life, you have a company that employs you, and pretty much every year they pick your health insurance for you. You might have a choice between one deductible or another deductible, you're not so sure. But when you turn 65, you have an opportunity to enroll in Medicare, and in today's age, you might still be working. That wasn't the case when Medicare was rolled out back in the 60s. People retired a lot younger than they do today. So if you happen to still be working now when you're age 65, if you work for a company that has more than 20 people, that's considered a large employer, you can stay enrolled with that company as your primary coverage, and then Medicare can be secondary. You can enroll in some or all of the parts of Medicare in that scenario, but you're not necessarily required to because you have that employer creditable coverage. If you're working for a smaller employer with less than 20 employees, then the opposite is true, and Medicare is primary, and that COBRA or that employer coverage is going to be secondary. And so, of course, then it's very important that you would make sure that you get enrolled on time during your initial enrollment period for Medicare, which is a 7-month window that surrounds your 65th birthday.
Are you sometimes amazed that the government took this plan and made it just so difficult to understand?
It's absolutely unbelievable. I don't know how anyone could have created a program like this and thought that a 95-year-old Helen who maybe doesn't have adult children would be able to make these choices every year. But even people that are turning 65, I've had a couple of really smart people over the years tell me they've had a master's degree or a PhD or that they built fighter jets for a living, and they're lost when they get their Medicare and U handbook.
Well, that's why we've got people like yourself to get on the radio and talk about it and clear up some of the confusion. So let's jump into it. Let's go all the parts, Part A, Part B, Part C, and Part D. Talk a little bit about all that and how it works together.
Sure. So original Medicare or traditional Medicare are parts A and B together. And these are the same original parts that we had back in 1965. They still exist today. They're modeled after that old Blue Cross and Blue Shield style of insurance where you had your hospital and your outpatient. And there have been some things that have changed, but those two pieces together have not. So these two parts will cover your hospital insurance, your inpatient hospital needs. This might include things like skilled nursing care, even hospice when needed. And then Part B is going to be your outpatient coverage. This is pretty much everything that's happening on a healthcare basis that's not part of an overnight stay. And those two parts together, being original Medicare, traditional Medicare, will be primary coverage for many people. And then they can add on supplemental coverage to cover some of the parts that Medicare doesn't cover. Now, Part C and Part D came along much later in the program. So Part C is an option for you to get your Medicare Part A and B benefits through a private insurance company that operates a network in your local area. So another name for Part C is called the Medicare Advantage program. And about half of people today are in original Medicare and the other half are in Part C Medicare Advantage plan. Lastly, we have Part D, which is the newest part of Medicare, rolled out in 2006. Believe it or not, back in 2005, I had clients on Medicare paying $10,000 a year or more for their medications because there was no drug coverage for over 40 years in Medicare.
Wow.
And so we're grateful to have Part D now, and that's something you can pick up separately that is going to help with your, of course, cost of your prescription drugs.
You know, I've had a lot of clients that were looking into Medicare, trying to understand it, trying to sign up for it, and what they didn't get, and I'm sure that you agree with this. I mean, Medicare is really a pretty good insurance program.
Mm-hmm.
Do you think so?
It absolutely is. In fact, yeah, it really is, and I understand why it's scary for folks, but actually, if you think about it, Medicare does work a lot like health insurance you've had your whole life. It covers hospital stays, it covers outpatient stays, and there's another part that covers drug needs. And so there's not a missing piece that's really going to be all that different from what you've had while you were working. It's just in a different format that you're getting it than you were before.
This is Bob Brooks, and you are listening to the Prudent Money Radio Show. Thank you so much for joining me today. You know I do appreciate it. We're talking to Danielle Roberts about her book, 10 Costly Medicare Mistakes You Can't Afford to Make. And if you want more information about Danielle, just go to boomersbenefits.com. Let's go back to part D and pick on Part D a little bit because you highlight a couple mistakes there in your book. You say that people make the mistake of keeping the same Part D plan every year. Talk about why that's so.
Yeah, so every year the insurance plans that contract with the Centers for Medicare and Medicaid Services file new plans for the upcoming year. And these things take into account any changes that Medicare has made. So Medicare from year to year will change premiums, deductibles, copays, and coinsurance on Medicare itself. And then the plans have to update themselves for what those new numbers are for the next year. So when you first enroll in a Medicare Part D drug plan, you might really like your plan. It covers the medications you need, your preferred pharmacy is in the network, and you're perfectly happy with it. But in June of each year, the insurance company that you're with is filing a new plan outline for the following year. And there are things that can change. It could be something fairly simple that you see on the surface, like a premium change. If a premium goes up, of course, that's a reason why you might want to shop the plan. But more importantly, what if they're changing their drug formulary and you have a medication that retails for $400 a month and you don't bother to look at your annual notice of change in the fall telling you that, hey, next year we're not going to be covering this medication anymore? Well, if you miss that altogether, in January, you're now in the lock-in period for the following year, and you're on a plan that is no longer covering an important medication. So it's really important every year to make sure that you review that drug plan, and is it still going to be affordable for you, and does it still have the pharmacies and medications that you need for the following year?
You know, you also talk about, this is interesting, not enrolling in Part D. Even if you don't take medications, I would think that a retiree would look at that and say, I don't need that. I'm not going to pay for that.
Yes. In fact, this is a great question because we just had someone in our Facebook group. We run a free Facebook group. It's called Medicare Q&A with Boomer Benefits. And we had a lady in there last week who was complaining that she and her husband were both paying $90 a month in penalties for Medicare Part D because they didn't know that they needed to sign up for Part D when they were first eligible. They were healthy, they weren't taking very many medications or no medications, and she was just unaware of the penalty. Well, for every month that you wait that you should have had the coverage, you're going to have a penalty of 1% of the national average premium, and that's cumulative. So by the time that she signed up, now she pays not only the plan premium, that penalty every month, and that will be forever for as long as she's enrolled in Part D, which will probably be the rest of her life.
So I don't really keep up with some of this. How much does Medicare go up every year, or does it go up every year?
There will be increases in the premiums usually every year. So, and there'll also be in premiums, not just premiums, but deductibles and copays and coinsurance, and those sort of things can change. So the Part B premium is something that you pay for your outpatient coverage. And for most people, if they're taking Social Security, that's going to get deducted out of your Social Security check before it ever even hits your bank account. And that's going to go up a little bit every year. So you may see a jump in premium that's anywhere from, say, $7 to $15 per year. And this is something you need to account for because you're also getting a COLA increase, but some of that you're going to end up paying back out in your Part B premiums that get deducted from your Social Security check.
And then you mentioned a second ago, and I've always wondered this. I've in the past had a lot of clients that would shop the market for these plans. And I always wondered, is there really that big of a difference between XYZ insurance company and ABC insurance company, two equal companies in strength, size, and all that type of thing? But is there that much big of a difference that they would pick one over the other?
Well, the good news with Medicare is that you basically have two routes that you can go. You're either going to have original Medicare and a Medigap plan that you add on, or a Medicare Advantage plan. On the Medigap plans, they are standardized. And so that's important because what it means is there's basically 10 plans you can choose from. And if you were to choose, say, a very popular plan is Plan G, a Plan G is a Plan G is a Plan G no matter where you buy it from. And so that simplifies the shopping process and lets you look for the insurance company in your area offering you the plan that you want for the lowest price. But on the Medicare Advantage side, there can be a lot more changes. This is now where instead of getting your benefits through original Medicare, the federal government itself, you're getting them through an insurance company that's operating a network in your local area. And the networks will be different. So you might have 40 different Advantage plans available in an urban area, and each of them are going to be contracted with different hospitals and providers, specialists, surgeons. You want to make sure that you're enrolling in a plan that not only covers all the medications that you take, since Part D is often included in an Advantage plan, but has a network that allows you to see your most important providers. And then the costs that you pay on the back end, things like doctor copays, deductibles, those will also vary from plan to plan as well. So it is something, it's not really a decision that you can just set and forget. There's going to be a little homework that you're going to have to do with it every year to make sure that you are in the best possible place for the upcoming year.
Danielle's website, once again, she mentioned that there's a Facebook group that's has the same name, boomerbenefits.com. You can go check that out for more information. Talk a little bit about Medigap supplement plans.
Sure. So the main thing to understand is that just like any other type of insurance you've had, there's premiums that you pay for the coverage itself, and then there's costs that you pay as you go. And these would be things like deductibles. If you have a hospital deductible, you have a surgery, stay in the hospital, there's going to be some money that you come out of pocket in your deductible before the insurance company kicks in. Medicare has these same things as well. There are deductibles and copays that you pay with Medicare itself. And on the outpatient basis, Part B, Medicare covers only about 80% of your healthcare services. So Medigap plans, also called Medicare supplements, same thing, just two different terms, probably to confuse us all a little more.
Sure.
These plans pick up that 20% and also pay some of the deductibles for you. And so you add a Medigap plan to your original Medicare coverage so that together you have a much more comprehensive picture and lower out-of-pocket exposure in the event of a major illness or injury.
And that is assuming that the average person knows what those words mean.
Yeah, yes, that's right.
You know what I mean?
People have to learn those, right, to begin with.
Well,
There's a glossary in the book that can help with that. But yeah, I think part of it's you bring up such a good point because a lot of these are terms that many people are not even familiar with, and so they have to learn all of this when they're diving in. And that's one of the reasons we recommend that you really should start studying Medicare around age 64. Don't wait until the last minute, right when you're about to enroll. You want to be looking at all of this. Give yourself plenty of time because there's going to be a learning curve there.
And correct me if I'm wrong, Danielle, you also update the book each year with the correct numbers. Is that accurate?
Yes, that is correct. So usually in November, we submit a new file, and that gets uploaded and updated so that when you're ordering the book for the next year, you'll get the correct numbers. But we also have people that sometimes will reach out to us because maybe they've picked up a copy at the library and it's a couple of years old, and there is a PDF that we can send out to someone in that scenario so that they have the current numbers, and all the other information, of course, remains the same.
So one question about the Medigap, and you had mentioned this in your 10 costly mistakes. Enrolling in the wrong Medigap plan. Talk a little bit about that.
Yeah, so with a Medigap plan, although there's 10 different options that you can sign up for and they're standardized, there are a few plans that are just more popular than others. And these plans, typically right now, we get a lot of inquiries for Medigap Plan G and Plan N. And that's because those two plans cover the most things on the back end. They're picking up a greater share of the things that Medicare doesn't cover. And so you might have somebody that really wants the most full comprehensive coverage possible. They don't want to be in the hospital worrying about what kind of bills are coming in the mail, and they're willing to pay for that kind of Cadillac coverage. Someone like that's going to be very well served by a Medigap Plan G. However, you have other people who might say, I don't mind coming out of pocket a little bit. I'm relatively healthy. I've had high deductible health plans through my employer in the past, and I don't mind taking on a share of that. And so someone like that might be better served by, say, a high deductible Plan G or a Plan N, which covers a little bit less, but also will have lower premiums. And so those 10 plans exist to kind of let you choose whether you want a little bit of coverage or a lot of coverage. The main thing to keep in mind with those is that no matter which Medigap plan you choose, there's no network. The network is Medicare. And so you don't have to ask your doctors, hey, do you take Blue Cross Medigap plan? All you have to do is say, do you have original Medicare? And then any Medigap plan will work just fine for those providers, unlike the Advantage plans where you have a network and it's really important to check that your providers are in the directory.
So back to Part D for the prescription drug coverage, do you find that this covers most prescription drugs, or is it limited in any way?
I would say that it's slightly probably more limited than maybe what you were used to with an employer plan that might have had a more robust selection. However, there's some important protections in Medicare Part D. The first one is that there's 6 classes of medications where the carriers have to cover all or substantially all of the medications related to that particular health issue. For example, antidepressants, anti-seizure medications, anti-cancer medications. You're going to find these in pretty much any drug plan that you get. And then every drug plan must cover at least 2 medications in any therapeutic class, so that if you develop a health condition mid-year that you never had before, there are going to be medications available on that prescription plan that will treat that. What you find in the limitations can be that there might be, say, 15 different medications out there for blood pressure or cholesterol, and the carrier might offer some of them but not all. So if you take a specific one and that Part D carrier doesn't offer that one, you can either look for a different plan that would offer it and be more suitable, or you can always submit an exception to the plan itself and say, hey, I'm enrolled in this plan. I have this new health condition. I don't see the drug listed on the formulary. My doctor has a letter here saying why I need this medication. And the plan can take a look at that and potentially approve it for you for the rest of the year until you can switch and get it on a plan where it's regularly on the formulary.
Danielle, people get Medicare and long-term care confused all of the time. Talk about what is covered and what is not covered, and how those two maybe complement each other, but they're not the same thing.
Yeah, I love that you brought this up because it's so important for people to plan separately for long-term care. So Medicare is covering your health needs, meaning hospital stays, doctor appointments, physical therapy. These are all things that are covered through Medicare itself. But Medicare doesn't cover the rent that you would need to pay to live in an assisted living or skilled nursing facility. It will cover up to 100 days in a skilled nursing facility if you've had a qualifying hospital stay of 3 days or 3 nights or more, and then perhaps your provider says, I don't think you're quite ready to go home yet. You've got some healing to do, wound care, maybe it's PT or occupational therapy after a stroke. It could be a lot of things. I'm going to send you to a skilled nursing facility for 6 weeks to recover. That kind of care is covered up to 100 days. But beyond that, nothing is covered. So at the 100th day, that coverage ends. And this can sometimes really affect people's adult children. Mom and dad don't have any plan for long-term care. Maybe they thought Medicare covered it. Now somebody's in a skilled nursing facility, and maybe the situation is they need care for a longer period of time, or there's some decline happening, and Medicare doesn't pay for that. So a long-term care insurance policy or another type of plan, the money set aside for that is really important.
Talking to Danielle Roberts about her book, and it's called 10 Costly Medicare Mistakes You Can't Afford to Make. If you want more information about Danielle, boomersbenefits.com. Let's talk a little bit about your doctor. How difficult is it to keep doctors when switching to Medicare?
Well, the good news is around 93% of providers in America accept Medicare. And so if you have a provider that you've seen for years, maybe this is your PCP, you go there once a year for your annual checkup. When you have regular health insurance through your employer, you transition over to Medicare, that doctor typically will keep seeing you because you're an established patient. And so we don't run into a lot of problems there. Where it can be tricky is if you're relocating when you retire. And especially if you're moving to, say, a smaller town, what happens is sometimes a doctor's practice will limit the total number of Medicare patients that they can see because they get reimbursed more for seeing actively working people with employer insurance than they do by Medicare. And so those spots in their practice may be full already because they have patients they've been seeing for many years who are already in line in front of you. So when you move to a new area, sometimes it can be a little difficult to find a provider that is accepting new patients on Medicare. If you're working with a good broker like us at Boomer Benefits, we have teams of people that can help with this. We can, pull up provider directory lists on Medicare.gov and sort through them until we help you find someone. But especially if you're moving somewhere where it's a smaller town or more in a rural area, doing a little homework about that ahead of time to make sure you have a provider that you can see is also important.
This is Bob Brooks, and you are listening to the Prudent Money Radio Show. We're talking a little bit about Medicare, and Danielle Roberts is my guest, talking about her book, 10 Costly Medicare Mistakes You Can't Afford to Make. And, I was thinking about making mistakes, and what just dawned on me is I think when people start this journey, that's what their biggest fear is. Am I going to make these mistakes? And a book like yours easily helps them understand how to not do that.
Yes, I agree with you. We were just watching people year after year make the same mistakes as everybody before them. It was, people stumble into the same problems, the same penalties. And so we decided to write a book about it. Hopefully help people avoid some penalties, late penalties, learn how to avoid costly things, and just be overall better prepared for Medicare itself. Okay,
my final question, and I hope that you have the answers to this one. When is Medicare expected to run out of money?
Okay. Well, it's a moving target because
it's all a moving target.
Always be kicking this down the road, right?
Sure.
We were as close a few years ago. They were saying 2027, but I think the current estimate is like 2035. So we've bought ourselves a little bit of time, and hopefully we'll find a Congress at some point that can work together to find a good solution for that.
Good answer. Okay, we'll see what happens, right? Danielle,
That's
once
right.
again, 10 costly Medicare mistakes you can't afford to make. Boomerbenefits.com is the site you can go get more information. Danielle, I would love to have you back sometime. It's great to have you on today.
Thank you for having me. Have a great day.
This is Bob Brooks, and you are listening to the Prudent Money Radio Show. Thank you so much for joining me today. You know, I do appreciate it. I love resources like this book, because it can give you a really good education. It's easy to read and understand, even though Medicare is not easy to understand. And it's got a lot of moving parts and a lot of definitions. And what is Part A, what's Part B, what's Part D. And I can only imagine some of the mistakes that you can make trying to figure all this out. Hey, this is Bob Brooks. You got a question for me, please go to the website, prudentmoney.com, and send it in, because we are all out of time till we do meet again next time. Keep the faith and have a great rest of the day.
That's all the time we have for today. Questions or comments for Bob, or to find out more great information like what you've just heard, visit www.prudentmoney.com. Be sure to join Bob Brooks again for the next edition of Prudent Money.